As many Americans struggle to pay rising health insurance premiums, a CBS News investigation has uncovered a scheme that could make those premiums go even higher. Rural hospitals are being exploited by some healthcare executives. They are using them to make up 10 times more from insurance companies. This raises costs for insurers, who may then pass the increase along to consumers. Jim Axelrod has more from our continuing investigation. Jim, good morning.
Good morning. We told you yesterday about a South Florida lab owner billing drug tests through rural hospitals to take advantage of their higher insurance reimbursement rates. Well, it turns out he's not the only one engaging in this questionable practice.
It's the state of the art.
Jorge Perez is CEO of Empower Group, a Miami-based healthcare company that claims to specialize in rescuing rural hospitals.
Currently, we have 16 facilities and we manage 3 more. And many of these hospitals were hospitals that were in distress.
It seems to me to be a very challenging space, rural hospitals.
Correct.
So why mess with it?
Because why not?
Here's another reason. To help keep them in business, insurance companies reimburse rural hospitals for lab testing at much higher rates, sometimes 10 times more than they would pay if the tests were run at an independent lab.
It's mind-boggling to think about all of the money that's been made through this.
Michelle Jordan is a lawyer who represents Campbellton Graceville, a rural hospital in Florida that's now closed. She says after Perez came in to manage it, he signed contracts with dozens of labs across the country to send their testing and their billing through Campbellton Graceville. The first to sign up was Doral, who owns Reliance Labs in Sunrise, Florida.
An accident can change your life, not only today, but forever.
He's also a personal injury lawyer.
Why was Reliance, a lab located in South Florida, sending samples all the way to this community in the Florida Panhandle?
I was told that they had so much work that they needed to basically outsource.
What's the real reason?
So that they could utilize Campbellton Graceville Hospital's reimbursement rates. These are the original patient records.
Those reimbursement rates made Perez and the labs millions. Jordan showed us the records that were used to bill lab tests through the hospital.
Reliance is all over here.
Yeah. They were paid about $67 million from our hospital.
These records, $67 million?
Mm-hmm.
For his part, Jorge Perez denied signing the contract with Reliance or any other lab.
No, this is all forged.
That says Jorge Perez, owner.
No, by the way, that's not even my signature.
Who forged those?
I'd love to get a copy of all this. I have no idea. I was never the owner. You can check in the state records. I mean,
So
this is all federal.
You never made any kind of arrangement with labs?
No.
So in the hospitals you're managing now, this practice no longer takes place?
Well, there's nothing about no longer. I don't do it. I don't practice that kind of, the management that we put in, it's not like that. We bring in other types of clinical services.
Which is why we were surprised after that interview when we traveled to South Florida, hoping to speak with the owner of Reliance Labs, Doral. Who did we see standing together in front of the lab? Doral and Jorge Perez.
Well, he didn't speak with us that day. In an email, Doral told us all testing at the rural hospitals you mentioned is properly billed. Last month, Blue Cross Blue Shield kicked 4 Oklahoma hospitals Jorge Perez co-owns out of the network, citing, quote, questionable billing for lab programs.
So, Jim, you just happened to get the 2 of them together? You just go to shoot and they're both there together?
Totally random day. We wanted
my.
to talk to Mr. Doral. We rolled up, taking some pictures, and who walks out of the front of the lab? Doral and Jorge Perez.
And George is saying, I know nothing about nothing. At one point, he did look at the camera like, is the camera still here? How long are you staying, Mr.
Some days it's better to be lucky
amazing.
than good.
Yeah.
Jim Axelrod, thank you,
There's a lot of
Jim.
good questions there.